As a music therapist, one of the first experiences I had in intensive care unit was with a 20-year-old redhead who was brought into our hospital brain dead. She was several months pregnant, and our hospital decided to maintain her body on life support until the child could be safely delivered. And the intensive care nurse asked me to see the baby. She knew that the mother would never be able to provide any stimulation or nurture. Now, I know that music therapy is an evidenced profession, but I tell you, at that time, I could not remember anything anyone taught me about working with someone who had no brain activity. So when I was walking into the intensive care unit, I did not know what to expect. And when I pulled the curtain back, my legs were wobbling. I walked over to her bed, and I saw this little lump in the middle of her belly. And I just gently placed my hands right over that little lump. And I began to sing. He's got the whole world in his hands. He's got the tiny little baby in his hand. And that baby began to dance under my fingers. I felt little knees and elbows rolling. I felt stretching. So I walked a little bit closer, and I sang a little louder and a little faster. This old man, he played two, he played knick-knack, and that baby's movements increased and the heart rate went up. And I thought, life on the inside responding to music on the outside. Several weeks later, when Samantha was born, she was lifted from the womb, and she did not cry. She sang. Maybe an E flat. And when I would go to the neonatal intensive care unit, and I would see her very distressed, splayed fingers, thrust tongue, scrunch face, or her levels of oxygen would desaturate, I would simply go over to her bed and lean down and sing, and she would calm, much like a picture of that little baby I saw on the internet and wanted you to see. That's what she looked like to me. It may surprise you that music therapy is genuinely a credentialed and degreed profession since 1950. There are over 70 colleges and universities that offer the degree, and there are over 7,000 plus of us throughout the United States and abroad that offer music therapy in so many ways, in multiple places such as hospice, prisons, school systems, pain clinics, nursing homes. And we do so with much passion. One of the ways that we provide music therapy, I want to share with you. I have seen music, the effects of it, in some of life's most complex and fragile moments. Many of those have been in a hospital. For over 4 decades, I have witnessed the healing power that music can have. I'd like to share some of those with you. So go with me to the Sideman Cancer Center. It's at University Hospital's Case Medical Center in Cleveland, Ohio. And I want you to go to the 5th floor with me. Mr. Z is there. His surgeon has referred him to me for coping. You see, Mr. Z is a doo-wop singer. And he has all the moves that a doo-wop singer has and a smile that is electric. But he is going to have a total laryngectomy. No more singing for him. And I honestly thought maybe music therapy sessions are contraindicated here because this man will only be reminded of the things that he cannot do. That could be depressing. But I went, introduced myself, and we built a rapport that was out of this world. And we redeemed the time and sang as much as we could prior to his surgery. And then the day he went into surgery, he said, Deforia, after this is over, could you and I work together to see what can be done with music therapy with people like me? And I said, I sure will. And subsequently, we did. The day he came out of surgery, and prior to his discharge, the intern and I talked about what we could do. And so on that day that he was to be released, we went into his room and we captured his response to one of his favorite Broadway tunes.
Start spreading the news. I'm leaving today. I know I want to be a part of it. New York, New York, it's up to you. New York, New York. Awesome. Awesome. You make it awesome.
Not contraindicated, for sure. That man was not just a survivor, but a thriver. We know that music stimulates diverse places in the brain simultaneously, and some of that allows the brain, especially if it's pleasurable music, to release its own endorphins, enkephalin, serotonin, our body's natural opiates, which can have an express effect on our emotions and our mood. Now, down the hall is Mr. M. He, you will see, is a most dignified man, an upstanding deacon in his church, married almost 50 years. He has had a stroke, and he has expressive aphasia. He understands what you say, but because of the brain damage, he cannot speak words. Before this particular time that you will see, I had been with him for a half hour, and he had been trying his best to talk to me. That's all that would come. So finally I just say, let's see if we can do a little singing, okay? Now, the literature says the music you like most is the music you're going to be most responsive to. So I chose a song that I knew with which he was familiar, and I'm going to use a technique called therapeutic singing. I'm going to sing some of it, keep a total beat on his hand, giving some kinesthetic input, but then I'm going to leave out some words with the hope that he will fill in. Watch his mouth.
This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine.
Music therapy and its techniques allow and promote the creation of new neural pathways in the brain that circumvent the damaged areas, creating a new route to enable us to sing or to talk. All right. This slide you have to read because I'm not going to talk much about it. Only to tell you, Cochrane Review has lots of good studies that show the data, the results of music therapy and how it can be used in numerous ways. In our hospital, University Hospital's Case Medical Center, we have done a couple of randomized controlled studies that have shown wonderful results. We did one to look at the effects of pain on patients who were under palliative care, and we found significant reductions in their pain. Similarly, we did one recently, over 200 patients, randomized control study, with patients who were undergoing breast biopsy surgery, and found that their anxiety levels were significantly reduced, and they were discharged sooner. If you don't think the hospital loves that, and the patient wanted to go home too. Now, we have seen patients respond to music therapy one-on-one beside their bed. We have seen that stress levels of some of the caregivers and our patient physicians, surgeons, as well as our nurses and nurse anesthetists, similarly have told us, you know, just watching the patient relax and hearing their music also can make us more comfortable. We are presently doing a study with sickle cell anemia patients, and we're looking at how music affects their pain, their self-efficacy, and their trust in the health system. And we're using these mobile recording studios so we can take this into the clinical area, into the infusion clinic, place earphones on the patient, the music therapist, and if the patient has a person with them, and they can all participate in the music therapy session without disturbing anyone around them. And we do this when a person is in severe pain. And the outcomes thus far have been wonderful. They allow us the opportunity to work with multiple types of patients. In 1984, my life changed in a split second. I was diagnosed with breast cancer, stage 2, and had a recurrence 10 months later. So how did music therapy help the music therapist? I could not sleep. So at night, I would take quieting music with rain in the background, and I would put it on and notice my musculature was definitely released, and also I focused my attention on that and let the music wash over me. As a result, I could fall asleep. The turmoil and turbulence in my head would not turn off. So I took pen to paper and put thoughts into lyrics and composed my own song of hope, much like I do composing songs for my patients. And one evening, I remember pacing in my living room, unable to get a grip. And I picked up a hymnal from my piano and let the pages inadvertently follow to any random page. And those lyrics on that page spoke exactly what I needed to hear. Sometimes the words or lyrics in a song speak to us in ways that words cannot. And people hear the message differently. So music gave me rest. It gave me voice, and it gave me hope. Somehow I feel equipped now to be a music therapist and share the same comfort with which I was comforted with those I see every day. So that brings me to the question, what will you do with this information that you've heard? Are you the mother or father of a child with autism? Might you ask that music therapy be added to your child's IEP so that their level of confidence and socialization would be addressed? Or do you care for someone with Alzheimer's or dementia who has a lot of agitation and sundowning? Music therapists have shown remarkable results for that, decreasing it. Or if you are a person with a traumatic brain injury or Parkinson's disease, there is a technique called rhythmic auditory stimulation, which can help stabilize your gait. Or if you're a hospital administrator, you just might hire a music therapist for the benefit of your patients. Now, so the last question, if you act in your sphere of influence, please do so, and never underestimate the power of one voice. And one morning, if you listen carefully, you may hear this old song my ancestors used to sing in a brand new way. Over my head, I hear music in the air. Over my head, I hear music in the air. Over my head, I hear music in the air.